Okay, thank you, Kia Meng, and nice meeting all of you on a working day too. And it's raining and you all are here. It's very good. Okay, about the One Care, I think Kia Meng gave me a set of issues to handle. One is what's wrong with the present system? Why talk of reform in the first place? Yeah? Can I have the next one? So let's look at the present system and what's the problem, because the doctors who are against this, the GPs also are against this whole One Care, and sometimes they argue that the system is all right. Why change it? I don't agree. System has got a lot of problems. It needs some kind of reform. Let's look at the problem. This is one of the main problems that the government system is facing. If you look on the top, that's pesakit yang masuk. Those who had admissions to government hospitals was about like 3/4. But if you look at the lower down, pakar, the specialists, medical specialists, surgical specialists, ONG, you see that most of them are in the private sector. So the first side itself, you can see that there's a big mismatch. People are still going to government hospital because of cost. But the majority of the people, and this also doesn't actually accurately cover because it's the younger specialists in government center. The older, more senior people with a lot of skill are in the private, So this is one major problem. Next one, you have a look. Now this is the situation in Ipoh now. Cardiac surgeons in government hospital, Ipoh GH, 0. There are 2 in the private. Urologists, for people who do operations on kidney stones and all that, 0 government, 4 private. Oncologists, 0 government, 2 in private. Cardiologists, 0 government. These are interventional cardiologists who do the angiograms and stents and all that. So this is the situation, you see. Next one, please. So basically now we have a 3-tier system. I'll give an example, practical example. If you have chest pain, let's say in Ipoh, you're from the 3rd group, you have chest pain, and you go to hospital. Quite fast, you can be referred to the specialist there in GH, see the physician, and get a stress test done, and say, yeah, something is wrong. Then's when the trouble starts, because Ipoh GH got no cardiologist, right? They got to refer to Penang, and Penang, to see the cardiologist, not to do any angiogram and all that, will take you 3 months, 4 months to get the appointment, So if you're lucky and you survive that long, you go and see the cardiologist. After that, again, you got to wait for the date for this, And then they'll say you got to put in a stent, and then the stent will cost you 7,000 each. You got to get money for that. You don't have money, you got to go back to welfare. So it takes a long time between diagnosis and treatment. If you're in category 3, rakyat biasa, it takes a long time to get your heart problem treated. If you're in the middle group, kaki tangan kerajaan, you can go to IJN. So it's faster. For government servants, pensioners, you can go to IJN. So IJN is about 2 weeks. You can get an appointment in 2 weeks, 3 weeks, and things can get done faster. But if you're in the top group where you have medical coverage from a card, then the next day, the moment you diagnose it, next day they'll do a procedure for you. So there is stratification. So you cannot say this is a perfect system. There's something has gone wrong, So there is a need for change. Next one, please. Then you get, okay. So because of this situation, people are not stupid, right? People realize. So now you get a lot of people coming to private hospitals who really cannot afford private hospitals. They go because they're scared. They're scared. There's fear of the government. They're scared something may happen, So they go to private. So I gave the figures, right? Still 3/4 still go to government, right? But when they first get sick, they may first go to private first, finish all their savings, get into debt, then only they go to government, That's what happens generally. So basically, it ruins a lot of people financially. If someone gets cancer or if someone gets a heart problem or whatever, they go to private first, they finish off their savings, then they come to government. So it's a big strain on many families, So this is a big problem we face. A lot of people come to me in private because they're scared to go to government, not because they can afford private. So this is the second thing, financial problems for the families. Third one, next one. This is, okay, that is the private doctor, and that's the patient with the card. Even if you got a card, you're not safe, because there's a tendency for some of the private doctors to overtreat. Because the card is there, So let's say, for example, you come in with the chest pain. If you can assess and say unlikely to be hard, no need to do anything further, just go and go and take exercise and all that. How much can you charge? You do a stress test. Let's say a stress test is negative. The family history isn't too bad, but still you cannot be 100% sure. But you can assess. You don't need to do, in the government side, they will not do anything further. They'll say, oh, okay, just watch your cholesterol a bit, go for exercise, lose some weight, But in the private side, there's a tendency to actually investigate further, because the card is paying, there's the third party payer there. So there's a tendency to over investigate. So even if you got a card, you're not safe, The tendency to be over scoped, over investigated, and even over treated sometimes. So it's because it's all by, it's so for me, for example, when I get patients with heart problems, I prefer to send to IJN, because in IJN doctors are paid more than GH, but they're not paid by what they do. They get a flat salary. So whether they do a stent, or they don't do an angiogram, or they do a cardiac surgery, the payment of the doctor's salary is not touched by it. When in the private sector, it's fee for service. So the more you do, the more you earn. So that actually blurs clinical decisions, because in medicine, a lot of things are grey. A lot of it is you got to guess, It's not an exact science. So you got to make a judgment call, and when money is there on your shoulder every time, the judgment call may not be the best judgment call for the patient. And this is the other thing. The government always says this, our healthcare costs have soared, It was 1 billion in 83, now it's 14 billion. Of course, the 1 billion 83, of course, inflation and all that. So maybe it's 2 and 14, but it's gone up many-fold. The $83 is not the same as a 2012 dollar, but even then, accounting for inflation, healthcare costs have gone up. So government is saying this is too expensive. We got to get, this can't be sustainable. Next one. The other problem we have in our current system is patients can go straight to see doctors. They can go straight to see the specialist. There's self-referral. Person has got a chest pain, they don't go and see the GP. They go straight to the cardiologist. They got a headache, they go and see the neurologist. They get some gastric pain, they go and see the, the gastro. There's no family physician. There's no, primary care doctor, and it's very expensive. If you go and see, there's a tendency you'll get investigated, or you go and see the more. So there's a problem in Malaysia again. It's costly as a systemic thing, If all these people were to go and see the primary care doctor first, who screens them and then decides who to refer, it's more cost efficient. So in Malaysia, this is a big problem. A lot of young doctors milling around the wards, not enough people to train them, So it's not good, not good in terms of our stock of doctors, our training and all that. So these are 6 problems that the current system has, you see. So it's not a system that is perfect and there's no need to change it at all. There are problems, there's serious problems. Okay, let's go next one. So what's the government proposal? I'll take you through this one. So the government now has come up with an idea. Basically, it's to cover cost, it is to bring in the primary care thing, it is to integrate public and private sectors, it is to have, okay, let's say the first one. The first one is, the key of this is creating a National Health Financing Authority, NHFA. That's the crux of it. And this is like a prepaid scheme. Everyone pays towards the scheme. They have estimated it will come to about 10% of wages. But they didn't say, to be fair to them, they didn't say all the 10% must come from your pocket. They're saying that maybe some percent will be cut from employer, some percent maybe government might put, So but they did say they calculate the cost for covering all healthcare in government as well as in private. It comes to 10% of wages. They did say the 10% figure. Okay? So this will be paid upfront. It will be like EPF, you got to pay, you don't pay, you get fined, it's going to be something fixed. Maybe 6% of wages, other 4% employer pays, or something like that. Not yet determined, okay, how, and it'll pay to the NHFA. And then, next one, the NHFA then registers all the GPs in town. All the GPs register with the NHFA, and the NHFA will give you a GP. Or your Taman got this GP, can have this GP, and other people have this GP. So divides out the population to GPs. Okay? So if David is not a GP, but David's GP, he'll get his set of maybe 1,000 families or whatever. 1,000 families times 4 is 4,000 population under him. And he is supposed to give them treatment free. Because the NHFA will pay him. They call it per capita payment. it's like UK lah, UK system. The NHFA will pay him a fixed sum based on the, if he's working hard, he wants 5,000 patients, they'll give him and he'll pay him a bit more. But he's supposed to look after them lah. He can't charge them. And the patient goes and sees his own doctor. He goes and sees David, free lah. But he goes and sees another doctor, then he pay lah. If you go and see your own doctor, it's free. You go and see any other doctor of your choice, you pay lah. Okay. So this sort of covers, so it's payment, so treatment is free. It also gets continuity lah. That means the doctor has got records of his 1,000 families. He got records. It's better follow up in that way lah, right? Okay, next one. So, and then also you will also get free treatment in the hospital. You get free treatment, but you must go through your GP. If you go to the hospital yourself, then you get the full cost lah. You got to go through the GP assigned to you, or GP you are assigned to, and the GP must refer you to the hospital. Then the hospital treatment also is free. But they're saying it's going to be for a certain package of illnesses, which they haven't specified. There's going to be a package of illnesses. When you want to go for cosmetic surgery, then obviously not lah, but they haven't said which are the ones it's not lah, They said there's going to be a reasonable package of essential services lah. They'll be free in the hospital. Okay, so that's okay. Next one. And then they're saying the hospitals now, they want to make the hospitals integrate both private and government. Okay, so and then they want to make sure the government, their perception of these guys is the government hospitals are inefficient. That's the perception. So what they want to do is now they want to corporatize all government hospitals. They become like little companies, but it'll be owned by government. They say they will not sell it. But then they're creating what they term Thatcher's term lah, internal market. That means the hospitals now will compete. The government hospitals got to compete with the private hospitals for funds. Okay. So let's say if the private hospital is very good, then all the GPs in that area will refer to the private hospitals. So the funds will go where the patient goes. If the GPs refer a patient to that hospital will get the money for that patient lah. Okay. So the government hospital is lazy, not very good. People won't go to government hospital, they go to private hospital. The funds will move to the private hospital. The government hospital got to downsize. Maybe the people will be taken up and work in the private. That's the concept lah. Use the market to discipline the hospitals. Make sure they are efficient. Internal market mechanism lah. So probably kill off all the private government hospitals actually, because the private hospitals already got a specialist. What you put them together at this point in time, people go to government now a lot because they have no choice. But you give them a choice and say this fund will pay for you wherever you want to go. Maybe you got to top up the private a bit more. People a lot more may go to private, and the government will just die off lah. But anyway, this is one of the ideas they're having. This is one of the ideas. Corporatize the hospitals, let them compete for the funds. So efficiency again lah, market efficiency. Next one. So you get the pooling of resources. You earn more, you pay 6% of your salary, is a higher amount. You earn less, you pay less. So he's saying it's solidarity. It integrates the public and private sector. He's got this gatekeeper fella, the GP, who reduces the cost, and it's got an internal market. So these are the things they're presenting lah. And now they're studying. They got I think 9 or 11 committees, and they're studying various parts of it and all that lah. This is in a nutshell what they have lah. Next one. But the thing is, you got to go one step back. Earlier on I talked about the 6 problems the government faced, right? Why the problems came about in the first place? Let's go back and see. Now this one I talked the problem of why is there so many people, so many private, so many specialists in private sector. You see, before 1980, the private sector was largely only GPs. There are a few private hospitals, but they're all mission hospitals, Lady Templar, Asunta, Ipoh Fatima Hospital. They were run on a missionary basis, on charity, There were very few commercial hospitals, and the government didn't give them licenses. Next one. Then along came Dr. Mahathir, and he said that, he's basically for private lah. And basically he argued, he says, that why are you wasting money, government money, looking after this rich tauques who come here, all